Hello, and welcome to Talk About It Tuesday. I'm your host, Keith Taylor. Today we're talking with our Quest coordinator, Juan, and we're talking about PrEP today. And Juan has decided he's going to give us his experience on PrEP. Thank you for joining us today.
Thank you for having me.
So to begin, let's start with, tell us more about Quest.
So Quest is Queer Unity Empowerment Support Team, which is an organization that works mainly with queer youth. We do a lot of programming for youth. We have support and support services. We have social and social groups, again, for youth and for some adults, among other services that we offer to our community in the greater Waterbury area.
Okay, cool. So, as we're talking about PrEP today, PrEP is a pill you take once a day to keep you from catching HIV. Remember I told y'all about that? PrEP up, step up, PrEP up, something like that. So anyway, so tell me, how old were you when you first heard about PrEP?
So I actually first learned about PrEP when I was 19 in school. I learned that, as you said, it's a medication that you take every day that helps you prevent contracting HIV.
Okay, yes, that's true. I got some more questions to ask you too. And so tell me how you feel about being on PrEP. Does you feel empowered? Do you feel like you're Superman or?
I do not feel like I'm Superman. Well, when I decided to take PrEP, I was actually 23. That's when I first approached my provider.
Okay.
And I decided to make the decision to take the medication.
Okay. And I applaud you for that because you learned about this, what was out there. You took some time to think about it. And then when it was time to get on it, you decided, okay, it's time to get on it. I like that. So, did you experience any stigma?
I did. I don't know if it was a stigma or it was that my initial provider was not very educated. I remember that my again initial experiences were not very positive with the providers that I talked to about starting taking PrEP. But then I found a provider and I found a place in which they provided all the information that I felt that I needed that helped me make the decision to start taking the medication.
Okay.
Yeah.
Did you feel stigma from the doctor?
Yes.
Stigma? Really?
Yes.
And
It seems like
tell
that
me-
there was a piece missing, a lot of educating. As I said, the initial,
Right.
the first time that I tried to get on it or that I talked to my provider about it.
Do you think it has something to do because you was part of the MSM population or?
I mean, I definitely do think that being a queer person played a role into our interaction and the experience that I had. But yeah.
Wow. Yeah, our doctors need to get a little bit more empathy or a little bit more education.
Yeah.
Along with our population, yes. So, so what about how often you see the doctors? How often did you go back and see the doctors?
Well, so once you start taking your medication, again, take it every day, and you should be getting tested every 3 months. So I go and see my provider every 3 months after I do my labs and make sure that I'm well and that everything is fine, and I have my checkup every 3 months.
Right. And we have to take the pill how often?
Every day.
And normally around the same time?
Yes, I try to take that helped me create a habit of remembering. So every day in the morning, that's when I take my medication.
Okay. So do you feel any in the population and talking about like when dating, do you bring it up in your conversations in dating?
Yeah, that is actually one of the questions that I have asked to people that I dated or to people that I have been in relationships with. That was one of the initial conversations we had once we decided to have sex or think about having intercourse.
Okay, so and what was it like? I mean, did you find people of our brown and black on PrEP or no?
I mean, I definitely think that there is a disproportion as into who is taking PrEP. Definitely, black and brown men are the rates of people that I have met and that I talk to
Right.
that are taking the medication are lower. But I think that access plays a huge role into it. One of the things that providers
Right.
a lot of times get wrong, it's the fact that a lot of times we say that black and brown men don't want to take the medication,
Right.
but I also think that it's important for us to ask if we are actually creating opportunities for that medication to be accessible to our communities.
Right. Even before we start asking them, can they even get it before
Yes.
do you know about, why bring it up if they can't get it?
And again,
But PrEP is widely available to everyone that has insurance, and even the ones that don't have insurance, I'm sure they can get it as well.
well, of course it is, but I think that that's when we need to ask ourselves the same way that I share my experience with my provider, right? I think that there is this distrust because of the history that black and
Yes.
brown folk have with the healthcare system that definitely justifies and validates that distrust
Yeah.
that exists. So educating our
Yeah.
providers, educating the centers that offer these medications is extremely important.
Right, and I think that even though we know that for the black and brown population that there is some mistrust, but how can we get them to trust? Like, what do you think that we can do to reach out to them to make sure that they are?
Well, I think that this is a bigger issue, right? That probably you and I are not gonna fix.
Right.
But definitely getting out in our communities and creating those relationships with the people within our community is extremely important. And also when we go back to our organizations, when we go back to state and local agencies, making sure that we have conversations around creating pipelines in which
Yes.
the providers actually reflect the population that they serve and not
Exactly.
how it currently is right now.
Right. So there you have it. We've been talking about PrEP, and I really thank you, Juan, for sharing your experience with PrEP with us. Join us next time on Talk About It Tuesday, where we'll be talking about something. I don't know. We'll find out something to talk about by then. So have a good day.
Bye.